So now we're going to have a closer look at the route of application. So one thing was that we said what time of the day or according to your lifestyle rhythm and your food regime, you should take the medication. And now it is, what is the pathway to take the medication? So normally everybody just assumes that most of the medications are taken orally, which is correct. Yeah. Then we have other medications, which I mentioned that earlier, which are applied through the nose. For instance, Shatbindutailam, Anutailam, and also certain dust inhalations or smoke inhalations are done through the nostrils. As we know, the nostrils have a very, very sensitive tissue, and it is highly condensed with blood vessels, so that we can easily administer certain medicine to the nostrils. In our understanding in the West, we mostly would treat the nose for rhino catarrh, means for cold. In Ayurveda, according to the Shalakya Tantra, the knowledge of the holes or openings, the orifices of the head, the application of medication to the nostrils is basically done to treat all kinds of disorders of the brain. Very, very different. And also we know that cleaning the nostril, cleaning the sinuses, for instance, with a neti, the jala neti, also helps to reduce anxiety and stress because the sleep will be improving. So keep in mind, application through the nostrils is basically for manas, for clarity of the mind and focus, and not so much for treating rhinitis. Then we have an application in Akshitarpana through the eyes. And again, the medium of the medication, which is here oil and smoke, and here it is basically oil, in particular Ghritam then, which is also butter oil. This is mixed in here with Srifala, so we can get impurities out of the eyes, and it's very good when people suffer from allergic eye inflammation, when they have they can't see at night, when they're short-sighted, or the eyes get tired after a while because they have been working on a computer. So there's several things where you basically put a kind of a dough around the nose, around the eyes, and then you fill in the cavity with the melted ghee, with Trifala. It burns like hell. And the other option is you take a glass and then you just blink several times so that your eye gets really moisturized with all the ghee. Then we have an application through the ears, and nowadays in the West it's also very common to have ear treatments with the ear candles. I sometimes use that in Ayurveda as well, because I feel treating the ears is just very soothing. It calms the nervous system. People get very happy. They are very chilled. It definitely helps them to relax. So during Panchkarma, during also Rasayana, or also during a common treatment to reduce anxiety, we fill up the ears with some oil. For some people, they say it also helped them to deal with the tinnitus, but we also know tinnitus is a tricky thing, and hardly anyone can claim that they have healed more than 10 people from tinnitus. It's a really stubborn thing, and people arrive basically a bit too late to really treat it, and it has so many different causes. If it's like a noise trauma, people have been standing close to a beatbox, then this instantly done will help a lot. I always have a little mirror. I look into the ears, because sometimes people have a lot of cerumen, which comes from an excess of attempt to clean. So they use the Q-tip and they kind of want to dig it out, but actually, they're pushing it in further into the ear, and then it sits in front of the drum. If I then pour oil in, the oil has the tendency to penetrate around the cerumen and then really block the drum. People get very upset because they can't hear anything. It's just like the same thing you have when you go swimming. So just check the ear if it's really possible, or if you just send them to a specialist to just scrape out the ears before you start your procedure. Good. The other thing is, of course, the Gandusha, it's the application of oil, which is now also very fashionable in the West, that people just do the Gandusha in the morning. They just put oil through their mouth. In classical Ayurvedic text, I just have to mention that because I think it might be important, and we don't know how important it actually could be possibly, is that this is only done under the supervision of a physician. So here, with my patient, they just stand alone in their bathroom, and there is an incidence of increased fainting reported in Ayurvedic texts, and I would just share that so you can make up your own mind. But I would say it's actually not a really necessary procedure. I talked to several dentists, and they were also a bit suspicious because we have different types of bacteria, and the minute we have little gaps between the tooth and the bone, little bags, and there are particularly aggressive bacteria that don't need oxygen living there. And then you put oil above them, they're extremely happy. They breathe very well because they're not disturbed by oxygen, because oil is against oxygen. That's why we put it on the pesto so it doesn't go off. So I'm not the biggest fan, particularly not if it's then coconut oil and then mixed with herbs, because then you get a whole different thing together, right? If it had been sesame oil and spit out, it definitely has a slightly cooling agent, but if it's coconut oil, then it is very cold and doesn't really have the effect that you wanted to achieve. So the next one is the basti. So we have the Nirua basti, and we have the oil basti. So we use the quat, which we had in our last course, to do a water enema. And how to check the temperature of the water enema. It is very easy, just you like to do with your baby bottle. You take a drop of the liquid and then you test it on your inner wrist, and it should not feel hot, it should not feel cold. This is the exact blood temperature that you have, and it's always a measurement that you carry with you. So very handy, you don't need a thermometer. So anything that is put into the intestine, there has to be an increased cleanliness, of course, necessary. We also use long tubes, and then with a syringe, so we can also get the Nirua basti just a little bit higher up. And it's very important when we come to the Nirua basti that we know the person should be basically on a fast. So either they do it in the morning, which means they have been fasting during the night, or they do it in the evening, but then they should not have eaten for a couple of hours, at least, let's say 6 to 8 hours before that. So the other one is the oil enema. And so the oil enema, we also can use a syringe, which is very handy, and we are injecting this extremely slowly. And we start with something like 10 mil, and maybe 50, then we go up to 100 mil. Mahanarayana, Thailand, is a very popular oil enema, and we use it particularly for all vata diseases or urogenital diseases. It's very nourishing. It's for the weak people, of course, weak in the sense of vata. Yeah. For some people who get very nervous, we had, I think in the last 20 years, we had 2 accidents that people really just had a problem with defecation in the bed. There are little elderly people, nappies available, and that you can provide to the patient, or when you apply it yourself, so you're completely sure nothing is going to happen, and your sleep will be really nice and sound. And people say actually, when they started the oil enema, they do sleep much better. Also, not only due to reduced pain, but of course the vata is going down.